Welcome to our third module on laparoscopic knot tying. The prior two sessions focused on the mechanics of knot tying using instruments. In this video, we will go over the general concept of ergonomics and the two technical challenges specific to laparoscopy. The first being limited range of movement due to a fixation at the port site, and second, the difficulty of depth perception due to the 2D rendering of the view of the surgical field. Ergonomics is critical for any fine motor tasks and especially important for laparoscopy, where the fixed trocar sights and long instruments can lead to some very uncomfortable positions. Two key points to note are the table height and the distance to the patient. The two body parts that will tell you whether you have a good positioning are your elbows and wrists. With laparoscopy, the long instruments and insufflation of the abdomen will effectively raise the height of your working space, and therefore you will often need to use steps. You can see in this first picture how one can compensate with flared elbows, or in this second picture with overflexion of the wrist. Neither of these positions will allow you to do your best work. In this third picture, the surgeon is now at a correct table height, but as you can tell by stretching of the scrub over the chest, that the position isn't ideal, and this is because the surgeon is standing too close to the patient. By moving back, he is able to achieve optimal positioning with neutral and relaxed elbows and wrists. The other equation of the setup in laparoscopy is the relative position of the trocar to each other and also to the surgical field. If they are too close or too far away, you can really struggle. Although the general teaching is to have a hand's width between trocars, this rule is a very general one that is dependent on other variables including patient size, size of the surgical field, and surgeon height. In this picture, the surgeon is at the appropriate height and distance from the patient, but because the surgical field is so close, the port sites are further than ideal from each other, resulting in a flaring of the elbows to compensate. These side-to-side comparisons show the working angles and how they are impacted by the distance of the surgical field. A learning point is that if what you are working on is further away, the ports should be further away. And conversely, if the structure of interest is closer, then the port can be closer to each other. Lastly, the above points hold very well when the surgical field is fixed, such as for a cholecystectomy, but most operations involve work in multiple areas in the abdomen, which means you'll ultimately have to make compromises at certain points in the operation. Let's move on to the first technical challenge of laparoscopy: restriction in movement. In knot tying, the main way to compensate for the loss of freedom in movement is through rotation of the instruments, and also to be particularly careful about the initial setup. Here we see the standard creation of the C loop, but now watch carefully as the needle driver in the right instrument is rotated clockwise to provide a more optimal positioning of the suture for forming the loop. For the contralateral side, the suture is rotated counterclockwise for the same effect. The second challenge is depth perception. Translating a 2D image to a 3D mental construct is not always easy. The main way to perform this task is to identify a frame of reference and also to try to view the task from an oblique angle. The surgical field itself serves as an excellent frame of reference. Tying close to the knot also has the benefit of allowing adequate slack on the sutures to prevent air knots and tissue trauma. As you can see in this clip, The surgeon repeatedly touches or rests on the sponge in the process of suture transference and formation of the C. Avoid tying in midair. Another tip is to use the other hand as a point of reference by touching or keeping both instruments close to each other. Lastly, by viewing the task from a slightly oblique position, the depth of field can be better appreciated. Thank you for watching.